Good afternoon. Thank you all for being here this afternoon. The announcement today is twofold that we're going to talk about today, and the first one is that North Dakota is officially declaring a state of emergency in response to the coronavirus. But I want to make sure that everybody hears the word state of emergency. That might provoke a certain thing, an image in your mind, but what really want to say, because North Dakota is so well prepared, we'd like to actually declare a state of calm as opposed to a state of emergency, because North Dakota is so extremely well prepared and well positioned because of the great work that our teams have done, and also because of the geographic benefits of being one of the last areas to have an incident of confirmed coronavirus case. We, of course, yesterday reported that we had one positive case. Part of the other news we'd like to report at this conference is there was 10 more tests that were completed today at 3 p.m. through our State Department of Health laboratory, and all of those 10 were negative. And so we continue to only have one case, positive case in the state that's been confirmed so far. As always, I want to start out with gratitude, and I want to thank again the leadership at the Department of Health, Superintendent Baesler, the Department of Public Instruction, our Adjutant General, General Dohrmann, who's here. They're all here with me. You'll hear from each of them. I also want to thank our tribal leaders. I see Mark Fox is here from MHA Nation. We've been working with them. We got a call with tribal leaders set up this afternoon. We've also been in contact with mayors and county officials from across the state. We had a statewide call yesterday with folks from long-term care associations and hospital associations. These calls have been going on statewide. So again, I want to thank everybody from the private sector leaders, business leaders, and everybody that's all contributing to this state of calm that we have going on. The other topic we want to talk about today is some guidance relative to K-12 and K-12 staying open. But let's just talk about the actual action of signing an emergency declaration for a state of emergency in North Dakota. By signing one of these, by the powers that are invested in the North Dakota Constitution, it gives the governor additional powers under the terms of an emergency. This may be the first time in the history of the state we've declared emergencies, of course, many times in our state for flooding, for droughts, and for other natural disasters. This may be the first one related to a statewide public health emergency. But some of the things it allows us to do under that emergency declaration include the ability to activate the National Guard. And of course, we've done this during times, like I said, of flooding is when they've probably been most visible. But the National Guard, the emergency services capability, could be helpful if we find ourselves in a more extreme outbreak. We also have an opportunity to waive certain regulations under a state of emergency, and some of these may be helpful when it comes to making sure that we can maintain proper workforce to deal with the emergency across the state, and it may allow us to activate other certain funds and resources. Earlier today at 2 o'clock, the President of the United States declared a national emergency declaration, and by us activating a North Dakota emergency declaration, this also puts us in a position to be able to receive and get access to those potentially the federal resources that may be coming our way. Part of that national announcement that there was a lot of positives in there for a small state like ours in the heavily regulated medical field, because there was a major deregulatory components as part of that national emergency declaration that was made today. Some of those related to telehealth, some of those related to the critical access hospitals. We have 36 critical access hospitals in our state. Those would be the smaller hospitals, 25 beds or less. They're under a lot of federal restrictions about not only number of beds, number of patients, length of stay. We've also got a lot of challenging licensure requirements in our states. We've talked about that prior to the whole coronavirus issue, that if someone might be licensed to be a nurse in Minnesota, they can't work in North Dakota. It appears that the national emergency declaration will help remove some of those licensure barriers, which again, particularly in remote areas, tribal areas, places where we've had trouble getting healthcare workers, that may help the movement of healthcare professionals to where we need them as this unfolds. So a lot to like about the national emergency declaration in terms of the additional flexibility it gives to organizations here in North Dakota that are on the front lines. Also, as part of that national announcement, there was a big major announcement about private-public partnerships related to increased access to testing, and we know that that's been a constraint, and this really opens up and moves it out of a government-only solution to a government plus private sector solution, and saw some very optimistic numbers in terms of the amount of potential tests that could be coming here. And the reason why additional testing is helpful, and additional approaches to testing, including the movement towards being able to have people be tested in their cars. In South Korea, if you compare South Korea to Italy, South Korea completed, I think, almost 140,000 tests in a very short period of time. And with that, a couple things happened. One is they were able to do better contact tracing in terms of who has it, who doesn't. That's a positive thing, because then you can go and not just isolate a country, you can isolate individuals who've come into contact. That's positive. It also, when you get more numbers, this is a math game, when you get more people testing negative in your denominator, it does remove some of the fear related to this, because when you got more people in your denominator, we may be finding out that this coronavirus is not as doesn't have as high a mortality rate as we once thought it did, because it turns out that perhaps in a majority of the people that get it, you get more traditional flu-like symptoms. We continue to see evidence that this coronavirus is has a lower mortality rate, meaning it's less lethal for infants, children, and young adults, and that's again a positive thing for all parents. But what it does mean is we do have to focus our resources on the state to protect those that are most vulnerable, and that's why again you're going to hear today that we're going to continue to amp up our efforts to make sure we're protecting elderly and people with chronic underlying diseases, in particular trying to make sure that we're doing all the appropriate measures to protect those that are in our 80 skilled nursing homes across our state, and really working to make sure that we can keep the virus out of those facilities and out of assisted living and long-term care facilities. From a K-12 standpoint, I'm going to turn it over here in a minute to Superintendent Baesler, but I want to again, we're going to make some announcements here that right now we're planning on keeping K-12 open in North Dakota. This may come across as contrary to what the wave in the last 24 hours of closures that you may have seen in other states. But we're making a decision, as we said, based on facts, not on fear. And we've been focusing since January about preparing, not panicking. And so our situation is different in North Dakota. We have one reported case. What that means is there is not one single hospitalization in any of the hospitals in North Dakota today for the coronavirus. Not one. And we also know that because this does not have the effect it does on younger populations, then we have to start thinking about it for a population like school age. We have to think about this like it's flu season. And we have to think about what would the things that we would do to make sure that we protect our children and protect our communities during flu season. And we should take the appropriate common sense approaches like we would for that, and not find ourselves in a position of overreacting, because if you do end up closing K-12, not everybody's got childcare. Those kids, parents are working, they may end up staying with their grandparents. That's not a good thing. We have a lot of kids that attend, our 120,000 K-12 students in North Dakota. A lot of them are receiving important nutrition as part of their attending K-12. Special needs, we've got an obligation to provide, schooling for special needs children. So it is not a simple equation to think about shutting down K-12 statewide, and it actually isn't even appropriate right now based on the CDC guidelines guidelines, which Superintendent Baesler is going to cover. So we have to be more specific on a case-by-case basis. We will be proactive about closing schools if we find that there are cases either in the schools or in the communities that the schools are in. And in the absence of that, and not just cases, but cases driven by community spread as opposed to travel contact. The one case that we do have in Ward County was an individual who was traveling. We actually know who they got it from because of that contact case. That person is recovering at home. And so we have no evidence today of community spread in our state. So again, North Dakota, we're taking a pragmatic, proactive, positive step, and again, acting out of facts, not out of fear, and making sure that we don't create a set of unintended consequences by doing, mass closing statewide. They're unwarranted relative to the current situation. So with that, I'll turn it over to Superintendent Baesler, and then from there, we'll hear from our State Health Officer, Mylynn Tufte. We may hear a few words from General Dohrmann. And then we'll be open for questions. But again, thank you to the media for being here. Thanks for the great work you're doing and getting out accurate information to the people of North Dakota. We really appreciate your playing an important part of this as we battle through this health emergency. Here's Superintendent Baesler.
Thank you, Governor Burgum. Hello, everyone, and I will echo the governor's thanks. Thank you for coming, and thank you for your role in keeping North Dakotans informed about the COVID virus and our response to it. I want to emphasize that the Department of Public Instruction continues to work closely with the governor, the Department of Health, and the North Dakota Department of Emergency Services and our North Dakota National Guard on our response. It is a work as one effort. So the Department of Public Instruction has distributed a memo to our educational leaders this afternoon to lay out specific guidance on many of the issues that the governor has outlined: child nutrition, school attendance, regular communications with students and families, routine cleaning and disinfecting of surfaces that people are likely to touch. And I also want to address the fact that there has been several queries to our office from both parents and students and educational leaders, especially particularly after the announcement yesterday that our university system and some of our colleges, higher ed institutions were taking some different actions. We should emphasize that just because some university campuses are shutting down or going to online, that our K-12 school systems serve a very different set of clientele. And some of the reasons why our university campuses and K-12 should not move in lockstep are, as the governor mentioned, children have not been identified as a vulnerable population who could become seriously ill from contracting COVID-19. Closing schools will leave many parents and caregivers without alternate care options, and many parents could be forced to stay home from work, including essential health care workers, emergency responders, and this loss of response and health care workers could have very unforeseen consequences on our ability to care for affected populations. And additionally, many families may turn to alternate caregivers, such as grandparents and other extended family members who are more vulnerable to COVID-19. I will say that historically, the decisions to close school have been most often made by our school district superintendents, but during decision to close schools regularly made by local superintendents in response to weather and other events in order to maintain the health and safety of students and staff. However, during a health-related outbreak such as this, it is recognized that local school districts look to their state health, safety, and education agencies in addition to their governor's office for direction, and that's why we're here together. We remain committed in providing you the most current and updated information as we move through this. And so with that, I would like to move through the guidance that the Department of Health has developed for North Dakota schools in particular. So if a COVID-19 case or cases are in North Dakota but not in your community, the North Dakota Department of Health does not recommend school closures if cases are not occurring in your community. Schools should follow the CDC guidelines regarding preparing for the COVID-19, and guidance, as I said, includes monitoring absenteeism, keeping sick children home, ensuring hand washing, environmental cleaning, and communication with parents. And that's where we're at in North Dakota today. There is a case, but it is not in many communities. It's in one community. If a COVID-19 case is in your community, but not in your school, The North Dakota Department of Health does not recommend school closures if ongoing spread is not identified in your community. Again, schools should follow the CDC guidance regarding the preparation for COVID-19. If COVID-19 spread is in your community, if we reach a level where it is in your community, but there are no cases in your school, the North Dakota Department of Health may recommend schools close in an effort to reduce spread in the community. But the North Dakota Department of Health will work closely with the school and community leaders to provide guidance in the event of that occurrence. And finally, if a COVID-19 case or cases are in your school, the North Dakota Department of Health will notify the facility. If a school is made aware of a COVID-19 case prior to being contacted by the North Dakota Department of Health, we ask that school to contact the North Dakota Department of Health immediately. The North Dakota Department of Health recommends that the school close for at least 72 hours following a confirmed case of either an employee or a student. 72 hours will allow the North Dakota Department of Health to conduct contact tracing and make recommendations for which close contacts should be quarantined, isolated, and excluded from the school. This time period will also allow the school to conduct environmental cleaning. If a second case occurs in the school within 14 days of the first case, then the school is recommended to close for 14 days in an effort to reduce spread in the school, and the school could then again conduct environmental cleaning during this time. So again, we are at the first scenario where there is a COVID-19 case in North Dakota, but none as a community spread and none in our schools at this time. This information can be found, of course, on the state website and with links to the North Dakota Department of Public Instruction website. Thank you.
Thank you. I appreciate being here with the governor and Superintendent Baesler. There is so much going on, and as we talked about just yesterday, this is a constantly evolving situation, and our preparation is key, and our not panicking is key for how we come together on this public health crisis and emergency. So, as we talked about, there's one positive case in North Dakota. We have done 63 tests. 46 of those are negative. 16 are pending at this time, and the one positive. What you've heard about, and maybe not as clear, is the North Dakota Department of Health and our local public health partners that will do a lot of work around making sure that people are safe and that their health is protected. When we talk about contact tracing, we're talking about interviewing the individual that may be ill, the individual's contacts, where they might have traveled, who they might have had that close contact with. So I want to echo our commitment to the public and our commitment to your health and safety. Today, we wanted to increase access to testing because we know that that is a concern of our citizens. The North Dakota Department of Health sent out a health alert network to our healthcare providers, stating that they no longer need to call us for confirmation of testing, that it's within their judgment to do that. We have provided recommendations that we have used, and that is still our recommendation. But it's up to the healthcare provider to make that determination. There's no delay. We can do the testing. So we want to make sure that you have the number to call in if you have questions for the hotline. It's 1-866-207-2888. 2888. So you could call us and we will answer the phone and we will provide information. And as always, you can reach us on the North Dakota website under coronavirus and see how many tests we've done, what the status of those tests are, and where individuals, if and when that comes from a community standpoint, we will tell you, you will know, so that there isn't anxiety and there isn't panic. We appreciate your help in helping us manage that and really being a neighbor to our people here. Thank you.
Thanks, Mylynn. General Dohrmann, maybe we'll step up and say a few words about the Unified Command as part of issuing the emergency declaration that officially stands up our Unified Command. General Dohrmann will be one of the leaders that will helping drive that, and maybe you just want to share with the group what that means and talk about, we've been having meetings since January, but now we're having an official first meeting tomorrow morning.
Yes. Thank you, Governor. You gave me the option to talk yesterday, and I didn't take advantage of that, so I'll talk today. Let me start with when Governor Burgum took over. He made it clear to all of us in state government that we're going to break down the silos of the bureaucracy and work as one. And that's really what this is all about. Speaking first as the Director of Emergency Services for the state, we've been working hand in hand with the Department of Health since they set up their Emergency Operations Center back in January. As additional resources were needed, we worked with them to make sure those resources were available for the Department of Health. With the President's declaration today and the Governor's declaration today, I think we're moving into the next phase. So what we're looking at with the Department of Health is transitioning the Emergency Operations Center from the Department of Health to the State Emergency Operations Center at Frayne Barracks, and really bringing in more of our partners because as some of these federal programs that the President talked about today and become available, we want to make sure we got everybody in the room that needs to be in the room so that we speak with one voice. We provide the best possible information so that leaders at all levels can make informed decisions. And what goes hand in hand with that is, again, preparedness, not panic, quash the fear, give folks the best available information to make decisions at all levels, and again, bring all of government together. The emergency declaration also authorizes the activation of the North Dakota National Guard. I don't see anything on the horizon where we need to activate the National Guard, but I can tell you that your National Guard is ready to go whatever the mission is. We've had extensive preparation for potential flood operations this spring. I can tell you those same muscle movements, those same leadership and staff requirements you need to fight a flood are the same ones you need for any other emergency. So the National Guard will be ready to go when called upon, if called upon, whether it's to help in the coronavirus response or if we have flooding this spring. So that's all I have, Governor. Thank you.
Okay.
My apologies, I didn't read my writing correctly and I didn't have this plugged into my cell phone. 1-866-207-2880 is the hotline number, 2880. So my apologies on giving out the wrong number first, but now you have it. Put it in your phone, 866-207-2880. Thank you.
Thanks, Mylynn. And I want to thank General Dohrmann and his team and all the great Guard soldiers that we have across the state that are both part of our full-time force and those that may be called up, because their motto is always ready, always there. And this is time we may need to call on them between this or between flooding, or if we have flooding and a coronavirus peak at the same time. We're going to be very thankful that they've done all the preparation they've done, and really, really grateful for General Dohrmann's leadership. With that, again, we'll open it up for questions.
What is environmental cleaning? Like, if you were to go into a school and do this, what does that consist of?
So I will defer to the Department of Health because that was their guidance. And there is actually a link on the guidance that will take you to specifically what environmental cleaning entails. But I believe Mylynn would probably be able to answer that.
I would also refer you to the actual cleaning. The people that clean inside hospitals, hotels, schools, they use professional grade cleaner that has a higher level of disinfectant. So that's what we're talking about, the professional grade cleansers, in addition to a time amount that it has to be on a surface and how they do that cleaning. So in hospitals, in hotels, on airplanes, in schools. They do this type of cleaning, and they're prepared to do that.
This is a question probably for Superintendent Baesler. Related to rural internet access, do you have a feel for the percentage of students across the state who have access at home to, high speed adequate internet versus the number of students that don't?
It's interesting that you asked that question. So the governor and I celebrated about 18 months ago the ability to have access, 1 gigabyte access to every one of our school buildings in the state, which is a nationwide first. I was just visiting with the band, Mr. Crothers, the executive director of our band association, and we're working to get 2 bytes of access to every home. But at this point, not all of our students are connected in every one of our areas in North Dakota by high-speed internet access. And so that could be problematic as we begin to discuss online learning. But I'd say that there's a vast majority of our homes are connected with high-speed internet, but it is not 100% coverage.
Do you have a feel, is it like 75%, 90%? Do you all have a feel for the percentage?
I couldn't speak to that specifically. I can get you a map with the color-coded of the access after this, but I can't speak to it now. I guess I would speak to online learning as far as you bring up a really good point. So as we talk about online learning, I should mention that most districts at this point are not prepared to implement a distance learning model such as online learning on this short a notice. And even those that are, there is an equity issue. There's a critical equity issue, because it's important to note that if educational services are being delivered to students in any form, in order for the district to remain open, those services must be provided to all students, including students who don't have access to technology. Some families that may not have a device per child, they may have multiple children and only one device. And as important, students receiving special education services and special education support that are covered under an IEP. That would be it's critical if the school district is going to maintain operations to some students, they have to provide those IEP services to all students. And so really at this point in our guidance that's on our website, DPI believes that for most of our districts, it will make more sense if the case occurs that we outlined with the community spread or school spread to cancel school altogether rather than organize a learning model that cannot be accessed equitably by all students.
What would have to change for schools to close?
I think that Superintendent Baesler outlined that, and we'll be sharing this online. She gave 4 cases that were described. Is there in the community? Is there community spread? Is it in the school? And we'll go through those 4 cases, and we provide a specific recommendation. I think that covers all the major cases, so we refer people to that. But generally, if you look at that, we're in the lowest position right now, so we're not making any recommendations about school closures at this time based on the fact that we've got only 1 confirmed case in the state, and it was not community spread. Also would want to offer a course that, again, in education, ultimately education is the parent's responsibility, and if we've talked about individual responsibility. If kids are not feeling well, they should stay home. If parents are concerned about their kids going to school, keep your kids at home, care for your kids. It's parents' primary responsibility. If teachers are not feeling well, please stay home. That's this all common sense things that we're talking about. But we've issued these recommendations, but as it stands right now, local school boards can still make their decisions that they need to make. But if local school board or superintendent has a question about should we be open or not be open, they can call us. We'll refer them to the guidance. They can talk to the Department of Health. And then again, if we end up with a hot spot with a number of cases, we'll move quickly to close schools and then take action from there, as was described. If we move down those cases, we will do that. But I mean, even in the state of Washington, which had the most number of deaths so far in the Kirkland nursing home example and where this outbreak really began, in the state of Washington, which has been very proactive, they've only closed schools in the counties, nearest King County where that incident. In the eastern part of the state, the schools are still open. And so I think even in places that have dramatically more cases than we do and have confirmed that they've got community spread, still have schools open. So I think that we're being proactive, and we're also being pragmatic here, and we'll move quickly if we need to protect the students of our state. But right now, we feel that this is the right recommendation.
There are other states calling for significant increases in testing kits and tools. Where is the North Dakota being met as far as reaching the demand for our testing tools?
Well, this was a big discussion, I think, nationwide. I think every governor had provided that feedback back to the federal government. Every Department of Health had provided that feedback. And while we still have enough test kits here at the state of North Dakota to meet the demand for the tests that have come in, as State Health Officer Tufte described in her remarks, we are loosening up the testing requirements, and so we will probably see an increase in tests. We're going to see an increase in demand for tests, and hopefully as that increased demand comes up, we're going to be receiving more kits. We added more machinery at the state lab over the last 48 hours to be able to process that, and then of course this private-public partnership, which was announced 2 hours ago, which is again where you've got all of the major pharmaceutical testing companies and Walgreens, CVS, Target, Walmart, all participating to provide many points of location where a person may be able to get swabbed in their car and get more testing done. And I would expect that we would see that over the next week or two. Also, I know that there are health organizations that operate in North Dakota, like Sanford, for example, that is working to amp up their capability within their labs. And so we're going to see a variety of both, private, public and nonprofit solutions where you can get testing. I mean, moving from this state lab only to lots of places where you can get testing. And I think that's going to really give us more information, as we say, about this, because we'll find that a lot of people, even if they test positive, may have very, very mild symptoms, and maybe it'll help reduce the fear that exists around this when we've got more data points.
What is the turnaround time for test?
Well, I was on a call earlier today with one of the leaders at the Mayo Clinic. They're one of the places that adopted a drive-by testing in at a clinic in northwestern Rochester. Yesterday, they were able to perform over 200 tests in their first day, and their test, they're advertising about a 6-hour turnaround time on their new rapid PRC test that they have. We're still operating in more of a 24-hour time frame here at the state lab. But I know that some of the solutions that the private sector and others are working on will try to accelerate that.
I have a question for Superintendent Baesler about students who receive free and reduced lunch. Can you talk about, first of all, the number of students or the percentage of students in the state that applies to, and then if schools were to close, are there any efforts in a way to keep serving those students?
Thank you. Yes, the average free and reduced in North Dakota was right between 30 and 40%, I believe. And so, but as we talk about food services that are that schools provide, many of our students rely on school breakfast and school lunch as part of their day, those that are eligible for free and reduced and those who are not. And so the continuity of food services, especially for our students experiencing poverty, is truly an important factor that NDDPI expects districts to consider before they have the decision to close school. The U.S. Department of Agriculture Food and Nutrition Services is providing states ongoing information to the states about these issues. North Dakota Department of Public Instruction is working closely with our schools regarding the options for serving meals should the need arise. I should also make you aware that in preparation for any of potential school closures, the North Dakota Department of Public Instruction has sought multiple waivers from the USDA surrounding this issue. The purpose of these 4 waivers is to support schools and communities in providing meals to children in areas experiencing school closures due to COVID. The waivers will propose to allow school districts to serve meals in non-congregate settings, serve meals through the summer food service program earlier than that normal start date begins at eligible and not non-area eligible school sites, and finally to serve meals that don't meet all of the meal requirements if access to certain food items becomes limited. So those are the waivers that we have into the U.S. Department of Agriculture at this point in time.
When do you expect to hear back on those?
So they've been pretty responsive in their answers to us. We began working with them early this week. I would expect that we would hear something by early next week.
For Governor Burgum, now that there's an emergency declaration, is the state going to be mandating long-term care facilities to cancel visitation?
It's not necessarily related to the state of emergency, but we have already issued guidance around that yesterday, and it sounded as though from the federal press conference today that there was also going to be some federal recommendations. In our discussions with the Long-Term Care Association, many individual institutions were already moving in that direction, limiting it to I'm going to say the term would be critical.
Essential visits
Essential visits.
that include end of life.
And yeah, includes end of life, but also, again,
Critical.
we also want to make sure, again, as part of those recommendations, put out signage at the front door, access through one entrance, hand washing stations, screening for people coming in, essential visits only. I mean, this is really where we have to create a line of defense, and the same thing there, where if we've got workers that are working in these care facilities, if they're feeling ill, they've got to stay home. And then family members, I know this is wrenching when you've got a loved one that's in one of these homes and they may be feeling, they feel isolated anyway when they might be in a home, but now you've got restricted visits. But this is, again, accommodations, whether it's Skype or FaceTime or other electronic means to stay in touch with people, to do that, I think is what we all have to work on right now, because we might put a whole facility at risk if anybody were to come in. So we're going to continue to work with that association to make sure that we're really tight on that front to try to keep the virus out of the 80 skilled nursing centers in our state. Anything else, Mylynn, you want to add on that?
I think you covered long-term care very well. Yesterday, I had a chance to talk to the Ann Carlson Center and that leadership team, and I was very pleased to see that they had already implemented these types of recommendations, and they're looking out for that population of children that have multiple chronic conditions and need to be protected. So we don't want to forget our children with special needs as being one of those vulnerable situations, and also that these parents are feeling the same disconnectedness because of these recommendations to stay away and only limit that to essential visits. So it's both older adults and then people with chronic conditions, and we know that there are some kids that live in congregate settings like that.
In the world of dynamic and changing information, Mike just shared with me that Governor Inslee in Washington has now expanded closures statewide. But again, I think this shows a pragmatic progression of closing them first in the areas where you've got identified contact, and then as you see a spread, then you move to get ahead of that. But we are today not in the same situation that other states are, so our recommendations remain as they stand.
Could that be a possibility down the road if cases became quite widespread throughout North Dakota?
I think it's certainly a possibility, and that's why we've issued the guidance that if we've got an increasing number of cases, if we see an increasing amount of risk, then we'll move more aggressively in terms of measures to try to protect citizens.
For Superintendent Kirsten, even though schools are not being closed, there has been suspension of the rest of the remaining of the tournament, sports and fine arts activities.
That's correct. The North Dakota High School Activities Association, I believe, just put out a release a few hours ago or a couple hours ago that made that decision. It should be noted that the North Dakota High School Activities Association is a membership organization that our school districts choose to belong to, and so they made this decision independently. I admire that decision. I think CDC does recommend that schools consider and districts consider non-closure social distancing is what they're calling it first, and examples of that include canceling of inter-district events, inter-school events, school assemblies, and even staggering school recesses. And so I think that the North Dakota High School Activities Association decision aligns with that recommendation from CDC very well. Truly what we are focusing on right now as we talk about school closures is we're maintaining the academic services and really postponing any non-essential activities, gatherings, or events at this time that would bring people together.
Guys, feeling left out. Thank you.
Yeah, I was gonna say.
Thanks, Dave.
So two questions. Number one, how's your staffing, and are they going to be stretched a little thin, possibly with two potential emergency situations? And secondly, what would be your role in this COVID-19 situation?
Well, as the governor mentioned, we'll be standing up the Unified Command. Right now, my guess is Mylynn Tufte, as the state health officer, and myself will form the leadership team within that Unified Command. But then we bring in everybody else in government that can help us through this current crisis. And whether that's the schools, higher ed, economic piece, we go across state government. Appointed, elected, it doesn't matter, but bring the whole team together. And if we don't know how they help, we ask the question, all right? Same thing I did with my staff. You're all on the coronavirus team right now. Think about what you have to do to help this organization, because I have to protect my force if I want to be ready to respond to floods or ready to respond in coronavirus. Stretch thin, no. We also have reservists that we bring on. We've already brought a couple of those on right now. We have more that we can bring on. And frankly, this is what we do. We've had activations in the past of the State Emergency Operations Center that have gone on for months. 2011, we were on for months. And part of the reason, too, we're moving emergency operations from the Department of Health to the State Emergency Operations Center is at some point, if we do have flooding, a lot of the same people need to be at the table. A lot of the same people have resource requirements. So to make sure we have all that in one place, so again, we can identify where we have shortfalls, generate options to fill those, and then allocate the resources to do the best we can to protect the citizens of North Dakota. And you asked two questions. I think I answered one. Is there another? No. Okay, thanks. All right, thanks, Dave.
Other questions? Hearing none, we'll just wrap up. Again, I want to close where I started, which is, again, gratitude to all of the health organizations around the states, particularly all the people that are working on the front lines, taking care of patients in skilled nursing, assisted living in our hospitals, in our clinics. This is an extra time of care and caution, but we really appreciate the people that are getting up every day and working in those health professions. Same goes for all of our teachers in the schools and people that are working to keep all of our students across the state safe. So we want to thank that, and of course the leadership of the state, including General Dohrmann and Officer Tufte, in terms of their leadership and how we're going forward. And again, in closing, I would just say North Dakota is well positioned and well prepared. We are going to bring not only a whole of government, but a whole of community approach in terms of bringing in all of the people in the community, because this is, fighting this battle is on the front lines. And I want to reiterate, again, we've been here talking about government organizations, federal funding. At the end of the day, this comes down to individual responsibility. If you're not feeling well, stay home. If cover your cough, wash your hands, be smart about, how you're interacting with people if you're not feeling well, because your actions, could actually be the things that helps keep other people healthy. So thanks everybody for the individual care that you're providing in our great state. And as I said yesterday, I think one of the things that makes North Dakota great is that at times like this, it brings out the best in North Dakotans, people working together to solve tough problems. And I think it's a time when we can all be be especially proud of the state and the people that live in it in terms of the way people are working together. And I want to again say that while we did announce a state of emergency, my sense from talking to mayors and hospital administrators and superintendents and leaders across the state is, in fact, we are in a state of calm, because that state of calm is because compared to just about any other place on the planet, we are well prepared and well positioned to handle what's ahead of us. So again, thank you all for your role in helping to get accurate information out to the people in North Dakota, and we'll continue to keep the communication flowing to all of you, even if events are unfolding around the clock or over the weekend. So again, thank you for being here today on short notice, and thanks to everybody in the state who's helping to work us solve this important health emergency.